Hey, and welcome to our 8th regional report out call. Been doing this a couple months now. It's February 2nd, Groundhog's Day. Happy Groundhog's Day. Punxsutawney Phil saw his shadow, so we'll have 6 more weeks of winter, unfortunately. But generally, we have pretty good news on this call. I'm going to start because the numbers are trending in the right direction. State leadership has felt good about us moving to an every other week format for this call. So we won't be here next week, but we will be again on February 16th and then again on March 2nd. So you can mark your calendar if you want to catch it live, but I highly recommend you go to our website, covid.ks.gov/report-outs and sign up with your email address, and you'll get this report emailed to you along with the dashboard. And we'll try and keep up to date what's going on with the healthcare system in your region, along with COVID testing results and vaccine rollout. So stay tuned. Please go give us your address. With that, let's look at the numbers. Hold on one second here. All right. So here we are in the north central region of Kansas. We'll look, no one reporting a critical staffing shortages. We know that still a lot going on. Our frontline workers have been through a lot and are carrying heavy loads, but it's nice to see that we don't have as serious an issue as we did before. As we look at the numbers of COVID patients, good news here. So confirmed or suspected COVID patients were at 36, which is just a slight increase from last week where we were at 32. But what is good is that when you think about it over 3 weeks, this was 82 3 weeks ago. What I'm hearing from most hospitals across the state is they're at 40 to 50% of the COVID patients they were at during the peak, which is really helpful. And you have 3 suspected COVID patients in ICU. And this number was 5 last week. And so ICU beds available were 17, which is the best number we've seen here in a few weeks, and 61% capacity there in the ICU, which is good. And then just a great story here on the case count. As you can see from our peak, it dropping consistently down here into February. Our positivity rate ticked up a little bit last week, staying under 10%, but North Central Kansas was at 9.45%. The state as a whole, just to give you an update, is at 6.44%. That's the lowest for the state since the end of September. And to put that, also, I heard Secretary of Health earlier today say we were averaging 2,500-ish cases a day at our peak, and we're now at 650 a day. So still COVID's going around. Don't miss that, but we're not at the crisis level that we were at before. Now, if you have COVID, you might find yourself at a crisis level. So please continue to mitigate on that. And now let me move over to our vaccine website. Again, kansasvaccine.gov, a great site here. Click on data and you can get to this dashboard yourself. They're rolling out the Find My Vaccine link tomorrow, is my understanding. But you can see this number was at 4.5% last week, now 6.4%. They've added the long-term care facility program on here too. This is the federal program through Walgreens and CVS to get long-term care patients vaccinated. What Secretary of Health said earlier, we're 3/4 of the way through long-term care patients, hoping to be done by the end of the second week of February, which is good. A very vulnerable population, as we know. And then you can see as the state's distributing through the counties and what that looks like. Of course, these numbers lag because the data entry is a little clunky on WebIZ, and people are short-staffed as they're trying to focus on getting the vaccine out. But the story here that we want to keep sharing with everybody to understand is it is a supply side issue with vaccinations. It's not a distribution issue. The state is doing a good job by having them in arms within a week of them arriving in the state. Counties, generally, it's taken 2 or 3 days at the most to get them out into arms from the time they get them, sometimes same day. So we got great people and great programs trying to get the shots into arms. But it is just trickling into the state. There's 800,000 people in Kansas that fit into phase 2, and we've consistently gotten about 45,000 vaccinations a week. Hopefully, going to get closer to 60,000 with the new increase from the Biden administration. But that's still going to take a long time for those 800,000 people to get 2 shots. So patience, and pay attention to what your county's doing, because they get to pick how to move through phase 2 and what that looks like. A lot of rural counties are getting about 100 doses a week. You can see that as you go through just the statistics on who's been vaccinated, the weekly numbers on first and second doses. But down here, you can see the number, what the different counties are getting. You can see a lot of counties that are here in this region, 100. Ellis getting 400 last week. So, it depends on population, and there's a few other things they factor into this distribution each week and what's going out. But that's part of what makes this website great, is you can see all these numbers. Appreciate the state doing their best with transparency and communication. But tell your friends, it's about supply, and as supply increases, you'll see more and more people get vaccinated. So there you go. I have run through numbers, but there's people that are the real heroes on the ground. And let's hear what's really happening. So we'll go with Carrie Ann first from Public Health in Ellsworth County.
Hello. Not much has changed since last week. Still, vaccine is hot topic. Just trying to get those out. I know we locally for our county did see a little bit of an uptick last week in our cases, but it was majority younger people, high school age kiddos. So of course that effect, if they're in sports or whatever, can cause havoc to other schools as well. So hopefully though, we see our trend go back down. These kids finish out the school year as normal as we can. Still big thing though is just the vaccines and getting them out. And like you said, patience with us with having to make the decisions on who we prioritize and all of that. We have been able to get both of our districts in our county vaccinated with first doses. We got that done last Friday and the week before that. So just moving forward, trying to convince everybody that we will get them vaccinated. We just, our minimum doses that we get every week just don't go very far. So we feel like everybody wants it. We understand everybody wants it, but just when they're going to get it, we can't guarantee that at this moment. So.
And do you know, Carrie, you may not know, are there people, and Heather, maybe I should wait for you to give an update. I will let you give an update, and then I'll ask the question if you don't get to it. Carrie Ann, did you have anything else you wanted to add?
I don't think so.
Okay, I'll come back with questions, so hold tight. Heather, give us an update from the hospital side of things.
You bet. Hi, I'm Heather Fuller. I am the director of the Sunflower Health Network with hospitals in North Central and Northwest Kansas. Yes, numbers are going down. The big focus right now continues to be the vaccine, working with health departments to try to get that coordinated and figure out who is eligible and get folks set up to do that. And that's been working pretty well, I think, within the region. Some of the same issues continue with staffing and morale, of course. Paperwork and reporting fatigue, I think, just having to report to a lot of different entities, filling out the surveys to get the doses, that type of thing. Hospitals, there are more hospitals that are allowing elective procedures or some of those same day surgeries, that type of thing that they weren't able to do before because of the higher numbers of COVID patients. And we do have some more hospitals that are starting to allow one visitor per patient for inpatients, whereas before they were allowing no visitors. So starting to get back a little bit to some of those things that we had done before.
That's great. Do either of you know how we're doing with the partnership between counties and hospitals as far as the vaccine rollout goes? Do you guys have any sense of what's going on in this region around that?
I think here, at least for Saline County, it's going really well, and they just have set up a central vaccination site that's at the mall in the old JCPenney's area. So they're working. There's 3 of them actually: the hospital, the health department, and then the Smoky Hill or Salina Family Health Care Center. So kind of trying to funnel everybody that direction. That way they can utilize staff from all 3 of those areas. But I do know that a lot of the other hospitals, and I'll let Carrie Ann talk for Ellsworth in that area too, but yeah, they are working together pretty well, I think, with that partnership.
And I agree. I think the partnerships are going really well. I know for us here in Ellsworth County, we're actually just right across the street from our hospital and rural health clinic. That's all connected. And we formed a committee together. We just felt like it would be more streamlined for the community members. First of all, it looked good that we were working together on this. So we've actually set up a team. We're going to be doing a vaccination clinic every Friday in part of the facility. At the hospital, they have a building behind them that is will work for us. So yeah, we figured there's no point in all of us using staff separately. We might as well just join forces and get all that done. So I do think, though, that the partnerships around the region are going really well with our hospitals.
That's great to hear. And how are you as two different counties approaching the prioritization inside of phase 2?
Like us, we prioritize schools and then basically just going to work through the rest of phase 2. We've had a list started for a couple of weeks now. We have close to 800 people on that list that are wanting it. Majority of them are 65 and older. Our other issue, though, that we're running into is all the critical infrastructure workers that want to be included. But it's just kind of a balancing game, because a lot of those places would take a large amount of our vaccines if we would vaccinate them all at one time. So it's just a balancing act. So
Yeah. I'm hearing a lot of counties that are focused primarily on age right now in that. So you're not alone in that. What about you, Heather? What are you hearing in Saline County?
Right now for phase 2, it's 65 and older is what they're doing. So, and I know those slots fill up very quickly, but people are excited to get in there, and they've started on the second round. They did several days last week, several days this week. So, folks have appointments. So I think it's running pretty smoothly now.
Okay. You guys hear anything about the surrounding counties in the North Central region at all? About how they're prioritizing?
Yeah, I think a lot of them still are 80 and older. Got a few that are 82 and older. So it just kind of varies by what their population makeup looks like. And
down in Sedgwick County, very populous county, we're still at 80 and over down here as we're working through it. Again, supply side issue. You'll hear me say it over and over again. A lot of people to get vaccinated. Fortunately, numbers are heading in the right direction right now, but just a race to get the vulnerable populations, critical people vaccinated. So appreciate it. Anything either of you would want to add before we wrap up? No? Gosh, Heather and Carrie Ann, you guys have been faithful to this process. So grateful for you both. I did. Dr. Watson has been a regular for us also. I'll share the screen that he had from today, just so you can see what the transfer situations is like. You can remember when this screen was almost all red. Again, a second week in a row, we're seeing even more green and yellow, and just a little bit of red out there. There is capacity in the system. He did say the transfers are much better, about an hour for non-COVID, an hour and a half for COVID. Those are the best times we've seen in several weeks. So anyway, just wanted to give an update on that as well. When it comes to bright spots, this got shared in the Northeast region as they were going through a VA there to vaccinate. They had these heroes from our military talk about why they chose to get vaccinated. Got love for my 91-year-old father to keep him safe, and just the love and the reasons that people are going and getting vaccinated. And it's just interesting to think about those people who gave to our country. Real emotional experience for Sarah, who was a part of that. And then also, we can't fail to mention that our own Kansas City Chiefs are in the Super Bowl for a repeat. And the NFL doing some really cool things. 7,500 vaccinated frontline workers being there, several from Kansas. gal from Hayes that got selected. First time on an airplane, first time to a beach. And she gets to see the Chiefs in the Super Bowl. So just nice to see some people on the front line being rewarded. I do want to, recommend caution to people. Generally, you'd want to get together with a big group to watch Super Bowl. Last year, if you didn't know the story, the Chiefs saved lives without anybody knowing. They were playing the 49ers, and had San Francisco won that game, I think they would have had a major outbreak because the virus was already in San Francisco. So if they'd held a parade there, you would have amplified the situation there. But because Kansas City won, the parade was here where it wasn't yet in any number, save lives. So let's let the Chiefs continue to do that this year. Be smart about how you watch it, who you watch it with plenty of ventilation, because you're going to want to be loud and you want to cheer and you're going to want to celebrate. My prediction. You heard it here first. Anyway, thank you all for what you're doing. Thank you to everybody. Again, it'll be here not next week, but the week after, February 16th. Go to covid.ks.gov, report-outs. Continue to get tested. Take the mitigation efforts. We're hopefully approaching the final innings of this thing, but you want to accelerate through the finish line. You don't want to limp across the finish line. So